Long-term care remains a top policy issue. It's a top concern for millions of Americans. One thing we can do is try to fix class, and that could be done by trying to work in some medical underwriting to keep some of the people with the most serious disabilities at enrollment out of the program. So we could do that by strengthening the work requirements, perhaps. Instead of requiring them only to earn $1,000, maybe we want to make it $12,000. Really make them work, so that at least the people who come into the program are not so disabled. The problem with that, perhaps, is that as we impose this medical underwriting to class, we make the program more like private insurance. And if it's just like private insurance, why do we need a government program? How is it better than private insurance? And also there's the question of, well, what do we do with these people who are excluded from class? We still have to think about getting them the long-term care that they need. Another alternative is to try to encourage more purchase of private long-term care insurance. So try to promote the private market. We've tried in the past some tax incentives, so states have offered tax incentives to people who purchase long-term care insurance. The premiums would be tax deductible, for example. It hasn't done much to spur coverage, but perhaps if we tried to market the need for long-term care insurance better, that might help. One of the things we know is that people whose parents were in a nursing home are significantly more likely to purchase coverage than people who didn't have this first-hand knowledge of what long-term care costs are and what it's like to go into a nursing home. And maybe, gee, if I had long-term care insurance, maybe I could stay out of a nursing home. So increasing public awareness might help. One could coordinate Medicaid plans better with private long-term care insurance, so that some people are reluctant to buy long-term care insurance because they think, well, Medicaid is going to cover me. Why do I need long-term care insurance? What some states are doing is that if you have private long-term care insurance, Medicaid, and once you've run through those benefits, because they typically don't last a lifetime, they only last for 3 years, maybe 5 years, depending on your policy, you could go on to Medicaid more quickly. You wouldn't have to give up all of your assets like you do in most states. We could consider plans to encourage people to put money into special savings accounts, sort of health savings accounts type of option, to pre-fund their own long-term care needs. Or we could do what some other developed countries have done, which is to create a real mandatory national long-term care program, kind of like Medicaid, where there are specific taxes that are dedicated to a long-term care health program that would cover everyone in the country, and basically it would be similar to having Medicare cover long-term care. Now it really doesn't. If we had Medicare cover long-term care, we'd have to raise taxes, we'd have to finance this, but it is another option.